traumatic brain injuries, concussions are treated now almost as a gold standard with hyperbaric oxygen. Welcome to the Institute for Ageless Living in Longmont, Colorado. Today we are talking about hyperbaric oxygen therapy. Hyperbaric oxygen therapy is well known in the medical community for treating both decompression sickness with certain hyperbaric oxygen units, and just recently has been found to be a paramount benefit in people with traumatic brain injuries and any kind of head injury, closed head injury, or concussion. We use it here for multiple purposes. It works by increasing not the oxygen flow. When I breathe oxygen in, I'm getting 21% oxygen to my body. If I put oxygen on, I'll never get more than at this altitude, I'll never get more than 21% partial pressures of oxygen in my body. So the pressure within the chamber itself simulates being at 66 feet in the ocean, okay, which the increased pressure on your body increases the partial pressures of the oxygen that your body is circulating. The benefits are many, but the main benefit with hyperbaric oxygen is for people with arthritis, people with aches and pains, injuries of any kind. Again, traumatic brain injuries, concussions are treated now almost as a gold standard with hyperbaric oxygen. And the other benefits are increased sleep benefits and whole body wellness. Can't think of a candidate that isn't a good candidate for this. Even a healthy individual that exercises 1 or 2 times a week would benefit from a session of hyperbaric oxygen 1 or 2 or 3 times a week, just for general well-being. Sleep relieves depressions, different factors that are caused by lack of sleep, by restless sleep. I can't think of anyone that wouldn't, even a healthy individual. You want to kind of dress the way you want, and the chamber itself can be fairly warm. So dressing in sports clothes or shorts is appropriate. And then before you go in, you can bring your radio, your iPad, anything to listen to music with earphones on. You can bring a book to read. You can take a nap, and you can prepare by bringing whatever you need to do those things. The most important thing about the treatment is the equalization of pressure in your middle ear. And you'll see signs all over the room, and your assistant that helps you go into the chamber will tell you that you have to equalize or valsalva your ears early and often. And as you go down to 66 feet, the first 30 feet are the most pressure change. And during that time, you will pop your ears, and you will expect them to pop as you go down. And once you get below 30 feet, the popping or the clearing of your ears, or the valsalva maneuver, will not be as necessary. And once you get down to that depth, then you're fine. And it's very important that you do that. Sometimes people nap in there, but after the nap, they feel calm, their mood improves, and again, just a general sense of strength and a vigorous improvement in just your look on life. If you're interested in hyperbaric oxygen, there's many things online, but you can also look on our website, and I would encourage you to pick up the phone and call us, make an appointment, and come in for a consultation, and give it a try.